So we want to make sure that you are heart healthy. One thing that can really affect your heart and overall health, of course, is your salt intake. No surprise there, but it's surprising the foods that contain a lot of salt. The Food and Drug Administration recommends people consume no more than 2,300 milligrams a day. All right, that's a big number, and it's hard to kind of fathom, but we're going to show you in just a minute. So for children, that number is a lot smaller at 1,500 milligrams a day. Studies show that 90% of Americans consume, quite frankly, too much salt. 75% of that salt comes from processed, prepackaged, and yes, restaurant foods. That's the reason it tastes so good when you eat out, right? Joining me now is Dr. Oluleye. Okay, I almost got it with Mayo Clinic. Anyway, good to have you. Thanks for being here. I do appreciate it. I have to tell you, when I was reviewing all of this yesterday, I mean, there's some things here that really are surprising. Certainly not pizza. As good as it is, there's a reason it's good, because there's so much salt in it, without a doubt. Because a lot of people add salt to their food to add flavor, but we really have to cut back on it because it leads to serious ramifications later in life.
Yes, it does. So basically, sodium is a mineral that attracts fluid, attracts water. And when we take too much sodium, then we're at risk of what we call water retention, fluid retention. And this comes with side effects such as weight gain and bloating. But most importantly, it causes high blood pressure, also called hypertension, which at least a third of the American population have right now, which in women actually leads to, more than 4 to 5 times higher risk of death compared to dying from breast cancer, which is pretty high. And then uncontrolled high blood pressure actually leads to heart failure, leads to kidney failure, and also leads to stroke at the end of the day.
So stop picking up the salt and adding it to the food. But the other part of this is really education, not just for us as adults, but also for children. So you really have kind of the top 6 things that you need to be aware of. Because, for example, I know that bread is on one of them, as well as sandwiches. Now, I probably pack my kids at least 4 times a week a sandwich in their lunch. It doesn't mean I shouldn't do that, correct? But I need to be cognizant of what else I feed them the rest of the day to kind of counter the salt in the bread?
Yeah. So what I tell people is actually you can look at the food label. So now manufacturing companies put on their, for example, on soap, they would be able to say that this is unsalted, this has low salt, and this has no salt at all. And when you look at it, they basically will tell you how much milligram of salt is in every serving.
Right, so sodium.
Yes,
right.
Sodium. And sodium can be written in multiple ways, either Na, sodium, baking soda, monosodium glutamate. So those are things that you actually have to look out for.
But how do I know when I look at this and it says, for example, 580 milligrams, how do I know how, I mean, obviously I'm not going to consume the entire jar, but what is that, what percentage of that is what basically gets me to my daily intake max?
So basically it says 580 milligrams per serving. If you're taking 1 serving or 2 servings, that's basically almost 1 gram at that time that you're eating. So you have to keep, for example, I tell my patients to keep a sodium tracker where they check how much milligram of sodium they take with each of their meals so that they can at least reach the 1,500 milligram per day goal of sodium.
Okay, so 1,500 milligram a day. That's your goal as an adult, but it's much less for kids.
No, it's about the same, and that's what the American Heart Association...
Kids like to have, maybe some popcorn as a snack or some crackers, and those are loaded with salt, so it's tough when you're trying to come up with a healthy option for your children when you're packing in their lunch. Okay, let's talk about some other things. Obviously, you brought salt. There's that. There's soup, which we talked about, which is important. Pizza, you need to avoid as well, and then cheese.
Yes, avoid cheese also. So basically, all this food contain more than 50% of your daily requirement of sodium. So if you eat this at one meal, then you need to be cognizant of what you need to eat for the rest of the day. So if you eat this for breakfast, then you have to remember that you have to cut back on your sodium as the day progresses with lunch and dinner. For example, 1 teaspoon of salt contains 2,300 milligrams of sodium, which is already way more than what the American Heart Association actually recommends.
A day?
A day.
1 teaspoon. So filling that up is more than what you're supposed to have in an entire day.
It's more than what you're supposed to have in an entire day. And the U.S.
That is eye-opening, right?
The U.S. population actually, on average, finishes 21 teaspoons of salt in 1 month. Compared to 9 teaspoons, which is recommended.
All right, so we have to read the labels also, Doctor. Thank you so much. It's important information. Keep it in perspective, certainly. I mean, you just have to consider everything you put in your mouth when it comes to the salt intake, and not just the calorie intake, which we tend to always pay more close attention to. So if you missed any of this interview, you can watch it, by the way, later this morning on newsforjax.com with the doctor. Just look under the morning show page. It'll be posted again about 10:30 this morning. Now we want to take a live look outside from our Clay